coming in to take over chest compressions.
It's a scenario they may have to face.
Okay, 3, 2, 1.
A patient who's had a cardiac arrest and who may have coronavirus.
Go out to the clean area.
Oh, you want me to leave?
Yeah.
Okay, fabulous. Great, well done. That's brilliant. So that's one cycle of CPR done. Fab. All right.
Crash team in one room.
That's it. So that's going into the bin now.
Training in personal protective equipment in another. They are brain surgeons, A&E nurses, and in a neighbouring theatre, anaesthetists. Here being shown how to intubate a COVID-19 patient while minimising their exposure to infection. They'll be using more protective masks when it comes to it, but for now they need to preserve stocks.
This is one of the highest risk areas that we have to do. We are close to the mouth, which is where the virus can be. So you'll see the team are training hugely at this particular procedure to be safe and to keep the patient safe.
What did it feel like to be intubating in that team scenario and with all the PPE kit on?
And the PPE wasn't as uncomfortable as I thought it was going to be to wear.
Yeah.
Especially as a glasses wearer.
Sat down and talked it through. Okay? Go at donning. But you might as well, we'll do doffing now and then we'll do it again actually.
In 2 weeks, 600 staff will be trained like this in this Cardiff hospital alone. Wales's biggest critical care team is about to get much bigger.
All right, this isn't going to be over in the next few weeks. This is a minimum of 6 to 9 months, up to 12 months, and it's going to be really exhausting if we don't pace ourselves.
How would you sum up what's going on here right now?
It's unique, it's difficult, it's energising, it's worrisome, but it's also something that intensive care was made for.
Are you scared by what the next few months might hold?
I think we always have an outer facade of calm in intensive care. We arrive at scary situations, we try to instill calm in a sea of chaos, and I think that's what we're doing. We're putting on that facade of calm, which helps. It makes a big difference. But, although I'm a doctor, I'm also a dad, a husband, a son, and so the things which concern me are not what we do in the hospital here. That's my job, I know how to do it. It's the things that happen elsewhere, actually. To those who are elderly, frail, vulnerable, or with serious underlying health conditions, we have not forgotten about you. It must be so hard.
Matt Morgan wrote an open letter for the British Medical Journal recently, inspired in part by thoughts of his parents who fall into the more vulnerable coronavirus categories.
The checklist is purposely designed to be used as a daily ward round, but there are...
And as he now helps circulate COVID-19 critical care video training to other intensive care units, his colleague Julie Highfield, the unit's clinical psychologist, is focusing on how to manage the personal toll this could have on frontline health workers.
We've heard accounts from Italy of staff having to make terrible decisions over who to prioritise for ventilation. If that is the truth of the situation, do you think that could happen here in your hospital? And if so, how do you equip your team psychologically for a scenario like that?
I think the reality is how can you prepare psychologically for something like that other than to know that it's a risk? I think it's important to know that no matter how much we might limit the health, however, we're always here giving the care to the best of our abilities. And that's the moral check when you come back to it at the end of the day. Did I do the best I can with what I have? And did I do it with compassion and care?
Everyone can feel the emotions in that. Yeah. This may be a reality. It hopefully won't be, but this is something that we have to consider going forward.
Planning for worst-case scenarios while they have time. Julie Highfield's staff wellbeing guidance is now being shared across the UK. They are also planning on how best to support families of those admitted.
It's going to be hugely difficult for families whose loved ones are going to be in critical care units, because presumably getting close to them is going to be difficult.
There are some options that we are enabling at the moment, which is family being able to be trained and supervised in personal protective equipment for those end-of-life situations. But the reality is that we're not going to have lots of opportunities to do that and lots of equipment spare to do that. And also, families might be frightened of doing that as well. So they're going to be torn. Do I go in and say goodbye and feel slightly at risk myself, or do I miss that opportunity? That's going to be really tricky for them.
I mean, it's extraordinary that these issues are now being considered in this way.
Yeah. Oh, absolutely, absolutely. We have an idea about creating a family liaison team in our unit, because what we're hoping to enable is virtual visits. So being able to kind of Skype and FaceTime instead, because it takes away the PPE, but humans need touch, and that's going to be hard.
I think my message is that we are doing all we can. We will be there for you no matter what. Listen to the science. Listen to the advice from experts. Science isn't perfect. It doesn't give us all the answers, but it's the best thing we have.
And so the COVID-19 training continues at pace, soon no doubt to be rapidly implemented, as the number of deaths linked to this virus continues to rise.
Well, joining me now are Roshana Mehdian, who's an NHS surgeon, and Chris Hobson, who's Chief Executive of NHS Providers, the body which represents hospital trusts and foundations. Chris Hobson first. When you take together the lack of ventilators, the lack, although it's promised, of protective clothing, masks and so on, and belatedly ramping up the testing but not enough, is the NHS ready for this crisis that is underway now?
So we know that there's going to be a big challenge here, but the NHS, we have 1.2 million staff who are all rallying round to make the preparations that are required. We know, for example, on ventilator capacity, we'll be able to go, we think, from 8,000 ventilators to 12,000 ventilators. We started off with 1,500 tests a day. You heard the Prime Minister say that we're now targeting 25,000 tests a day. We're looking at increasing the number of intensive care beds sevenfold is what we're targeting. So the NHS is doing all of the preparations that you would expect it to, and we have the advantage of the fact that we are, unlike in Italy, where it seemed to descend very quickly and be geographically concentrated, we have had the advantage of being able to see how others have experienced this, and we've had the chance to prepare.
And despite that advantage and the time to prepare, we're hearing reports that London paramedics are having their masks rationed, only one in a team of 2. That's unacceptable, isn't it?
So nothing could be more important than ensuring the safety of our frontline staff, on whom we are going to rely so heavily over the next few weeks.
Do you think they are safe, as things stand tonight?
And clearly, we can see there is a level of anxiety amongst staff about access to personal protection equipment. That's completely understandable.
Let me put that to Roshana.
Let me just finish, Kathy. So effectively, we know, because we've had conversations today with the national team looking after PPE, that there are protective clothing, that there are sufficient national stocks. However, there is some lumpy distribution, because effectively orders for PPE, for personal protection equipment, have gone through the roof, and the logistics are taking a bit of time to catch up.
Well, they
will catch up.
Let me put that to Roshana Mehdian. Do you feel that you are protected, that you have the right protective clothing and masks at the moment?
So I think it depends on what part of the health service you're in. I'm hearing different reports from different colleagues and friends. I have some colleagues, for instance, in the community GPs who feel upset because they've been given what seems to be out-of-date equipment. They've peeled back the labels and found different dates on them, although they have been then reassured that those have been tested and seem to be okay. They don't have visors on their masks, which they've been told, that's what they need. So GPs are facing one problem. Alternatively, in the hospitals, I've got colleagues who don't have masks and are seeing COVID patients very frequently. One of them called me yesterday, do you know where I can get an FFP3 mask from? I'll buy them myself on the black market. So, some of this is, as you say, a logistical challenge. We know that it's coming. We've been reassured that it's coming. But we're trying to help the population, we're trying to help other people's families, and we need to feel that we're going to be looked after as well.
How do you respond to what you've just heard there?
Well, I completely agree. So when we talk to our trust chief executives, as we've been doing over the last 48 hours, what they've got absolutely top of their list is the security and health and well-being of their staff, because clearly if our staff aren't reassured that they've got the equipment that they need, then and also they get ill unnecessarily, we're not going to have the number of staff that we need. So let me just assure you, this is absolutely at the top of the list of priorities for both trust leaders that we represent, but also national leaders, and there is a huge amount of work being done. And just to reinforce the point, we have been told really clearly there are sufficient national stocks of the required equipment. We just need to let the logistical distribution chain catch up because of the amount of orders that have come in, as you would expect. Very
then you
quickly.
hear about, not having the correct visors, out-of-date equipment.
Well, so on the out-of-date equipment, again, we know that to maximise the stocks, we have gone back, and Public Health England have tested that equipment, and we know that it's safe. So a very good example.
So you are using out-of-date equipment, but you believe it's safe?
No, we are using equipment that PHE, Public Health England, have tested and say is appropriate for use. I mean, the visors one, I had 2 chief executives today who said they are nervous about the fact that they are potentially going to run out of visors in the next 24, 48 hours, but when we then talked to the national team, they said there is no problem in terms of there are plenty of national stocks. We clearly just need to rush and order to you. So all I'm saying is, I'm just relying on the information that we've been given, is we recognise this is really important because we have to reassure our frontline staff, but all I'm saying is there are sufficient national stocks.
Roshana, Mehdian, do you and your colleagues feel fearful that you're at risk?
I think that goes without saying, really. I think, it's not just doctors and nurses, everyone's fearful at the moment. And obviously, doctors and nurses and healthcare workers are in harm's way. But, this is what we've trained for. And, we're going to do our jobs and we're going to look after people, but we need to be looked after too in order to be able to do our jobs. Right. So, I think what's important is communication, and we're hearing now that we do have the stocks. It's going to take a bit of time to get them to us. Well, that's reassuring to hear.
And I'm sure everybody is incredibly grateful for the hard work that you're doing. Thanks both very much for coming to the studio.